Please welcome Dr. Hooman Melamed to the show.
Welcome back. Thank you for having me. Thank you.
We actually have an animation. Walk us through what you did here.
That's the scoliosis, the operation. First, you put the screws in, the rod goes in, and you start cantilevering the rod slowly from the top or the bottom, and then you start putting the screws in, and you start slowly dialing the rod in as it's going. You can see the spine starts straightening it out itself. But you break the spine in multiple places first, and it helps to loosen it up to get the final correction. So Kyle's scoliosis, when he came to me, was like this. And normally, when we are born, our spinal cord starts all the way at the bottom here. As we, in the first few years of life, the spinal cord kind of migrates up to about here. But Kyle's kind of was stuck down here. And that's one of the reasons his scoliosis was rapidly progressing. So first, we did a minimally invasive, like microsurgery to release the tether cord. And sometimes, by undoing the tethering, the scoliosis kind of reverses itself. But Kyle's case was so advanced that it didn't, it just kept progressing.
So Kyle's mom, Dorinda, is actually here. And Dorinda, I want to ask you, as a mom, you had a mom sense and intuition that something wasn't right with that first surgery that was recommended. What were you thinking?
My gut said no, and I couldn't explain why, but I said no. And it was at that point I said, that's it, I'm going for other opinions, and I encourage every mother to do that.
Mother's instinct.
Totally.
Always.
Right.
Yeah.
So Kyle now first had the untethering procedure. Then he went ahead and had the spinal fusion surgery to straighten out his spine, added 3 inches in height.
Wow.
You all ready to meet him?
Yes.
Yeah.
Kyle, come on out, buddy.
So what's the height now?
6'3", I've been told.
6'3".
Okay, turn your back.
And straight as an arrow.
I'm just gonna stand back because you're
Back to back. Let's see. Another couple of months. You got your beat. So
I didn't know you became a giant.
Sorry, it just happened.
you grew, what, 3 inches in just a couple of hours?
Yeah.
And to go from this to that, you must feel so much better now.
Oh, absolutely. It's a huge change. The pain was the biggest factor of this, and I was living with constant pain every day, but I can't even express enough how much better it's gotten.
Well, Kyle, we know there's one person who's really, really happy with that. That's your mom, and we are just so happy you had this great outcome. Dr. Melamed, thank you so much.
Thank you very much.